A lot of men worldwide deal with erectile dysfunction, but only a handful look for medical help, either because they don't know which doctor to visit or feel embarrassed. So today, in this video, I will explain what erectile dysfunction is, its symptoms, causes, and medical treatment options. If you wish to know more about this subject, stick around for the upcoming video. What is erectile dysfunction? Erectile dysfunction is the inability to achieve and maintain an erection firm enough for satisfactory sexual intercourse. Erectile dysfunction can lead to anxiety, stress, low self-esteem, and contribute to issues in relationships for the affected man. The symptoms of erectile dysfunction may include the following: difficulty or inability to achieve an erection, and difficulty or inability to maintain an erection. Additionally, erectile dysfunction can be a sign of an underlying condition that is causing it and requires medical treatment. Before explaining what happens in erectile dysfunction, it is important to understand how the male reproductive system normally functions and all the events involved in achieving arousal and erection. Only then we will understand how various factors can interfere with and affect this process. Well, let's start by mentioning a bit of anatomy. The penis is made up of 3 cylinders that run along the organ. 2 are located on top, called the corpora cavernosa, and 1 below, known as the corpus spongiosum. The corpora cavernosa are covered by a membrane called the tunica albuginea and consist of erectile tissue with nerves and blood vessels, muscle fibers, and arteries. The urethra, the tube that carries urine and semen in men, is found inside the corpus spongiosum, which serves to prevent the urethra from being compressed during an erection. Now, let's move on to the next point. The male erection process is quite complex, involving the brain, neurotransmitters, nerves, hormones, emotions, muscles, and blood vessels. Likewise, mental health is crucial, and I will explain why shortly. Now, let's see how an erection happens. An erection starts with sensory stimulation, for example, visual, auditory, or tactile, or mental stimulation, like remembering something. With sexual stimulation, a signal is generated in the brain that travels down the spinal cord to the pelvic and penile nerves. Chemical signals are produced from the nerves that weave around the arteries, allowing a large flow of blood into the penis. The penis fills with blood, begins to elongate, and grow. When the elastic tunic and the albuginea are maximally compressed, the blood pressure within the cavernous bodies increases, causing the penis to enlarge and become rigid. The veins of the penis located at the periphery become compressed between the pressure exerted by the blood and the tunica albuginea, causing blood to remain in the penis and maintain the erection. These events need to be well coordinated and happen with the presence of male hormones, such as testosterone. After ejaculation or the cessation of sexual stimulation, a nerve signal is produced that opens the venous system, allowing blood to leave the penis, resulting in the loss of rigidity and a decrease in the size of the penis, leading to flaccidity. As you may have noticed, male erection is a rather complex process. Therefore, any problem affecting the brain, spinal cord, spine, or nerves, blood vessels, or testosterone production can disrupt this process and cause dysfunction. Now let's discuss all the possible causes, both physical and psychological, that can lead to erectile dysfunction. Among the physical causes, we can mention the following: diabetes, high blood pressure, heart disease, tobacco use, high cholesterol, obesity, overweight, metabolic syndrome, the use of specific medications, and the list keeps going. On the other hand, the brain and psychological factors also play an important role during the process of arousal and erection, and various factors can interfere at this level. The following are some psychological causes we can mention: stress and anxiety, depression or other mental health issues, along with relationship problems from stress, worries, or poor communication. In many cases, erectile dysfunction results from a mix of physical and psychological factors. For instance, a diabetic patient whose condition impacts their sexual response may experience anxiety about sustaining an erection. This anxiety may contribute to worsening or causing erectile dysfunction. Now let's talk about diagnosis. As with any medical condition or illness, the diagnosis is based on the patient's medical history, physical examination, and additional tests. Now here's the answer to my initial question. In the case of erectile dysfunction, it is necessary to consult a urologist as they are the experts in this field. Give this video a like if you had the right answer. During the medical evaluation, the doctor can diagnose erectile dysfunction through the medical history, your background, and physical examination. In this case, it is also recommended to seek a psychological evaluation to determine if depression is present, anxiety, or any other psychological issue that might be causing this condition. If there are chronic medical conditions, or if the doctor suspects an underlying illness, they may recommend additional tests or even a referral to another specialist. Tests to detect underlying conditions may include the following. As mentioned, the physical examination is important as it assesses the state and sensitivity of the nerves. For instance, if the penis lacks sensitivity to touch, it could indicate a nervous system issue. Blood tests can check for hormonal or metabolic disorders, for instance, diabetes, low testosterone levels, and others. Urine tests to rule out other medical conditions, or an ultrasound, which involves using a rod-shaped device that acts as a transducer placed over the blood vessels supplying blood to the penis. This creates a video image that allows the doctor to see if there are any blood flow issues. Now, let's discuss medical treatment. The first step is to investigate if there is any underlying medical condition causing erectile dysfunction, so it can be managed and improve the condition. It is also necessary to investigate if you are taking any medication that may be causing erectile dysfunction as a side effect, so the doctor can assess whether this medication can be changed for another. Furthermore, if you use tobacco, alcohol, or any illicit substance, stop doing so because, as I mentioned before, part of the consequences of using these substances can be erectile dysfunction. If quitting is difficult, it's important to get professional help. Now, a crucial point that shouldn't be overlooked is that a healthy lifestyle significantly aids not just erectile dysfunction, but our overall health, so it's important to maintain a healthy lifestyle, having a balanced diet and doing physical activity, as this helps a lot with hormonal and metabolic matters. Now, depending on the cause and severity of erectile dysfunction, a wide variety of medical treatments can be offered, including the following. Number 1. Oral medications that enhance the effects of nitric oxide, a natural chemical that the body produces, acting as a vasodilator to enhance blood flow, allowing for an erection when sexually stimulated. I won't specify any of these medications, as it's important to have a medical consultation for evaluation before taking them. A doctor must determine whether it is the best treatment option for you, as, like any other medication, they also have contraindications and potential side effects. Second, injectable medications into the penis. This method involves using a fine needle to inject a drug to induce an erection. Number 3. Testosterone replacement. As we discussed, one cause of erectile dysfunction can be low testosterone levels. Fourth, a penile pump. This device, or vacuum erection device, consists of a hollow tube with a pump that can be manual or battery operated. The tube is placed over the penis, and then the pump is used to suck the air out of the tube. This creates a vacuum that allows blood to flow into the penis, causing an erection. After the erection is achieved, a tension ring is put around the base of the penis to retain blood and keep it firm. Next, the vacuum device is taken away, and the erection typically lasts long enough for a partner to have intercourse. Afterward, the tension ring is removed. Number 5. Penile implants. This treatment involves surgically placing devices inside the penis. These implants consist of inflatable or flexible rods. Inflatable devices or prostheses enable control over when and how long an erection lasts, while malleable rods keep the penis firm but flexible. It is important to mention that penile implants are not considered the first line of treatment. They are generally recommended after other alternatives have been tried and failed. Just like any other surgery, these carry a risk of complications. Number 6, but still important, is psychological therapy. As I mentioned earlier, stress, anxiety, or depression can lead to or worsen erectile dysfunction. Therefore, it is important to seek psychological consultation for evaluation, and in this case, therapy can be done alone or with a partner. As we have just seen, there are many causes of erectile dysfunction, and for that reason, there are also many medical treatment alternatives. As I have always said, this should be individualized. Additionally, when consulting with a neurologist, he will be able to explain the benefits and drawbacks of each of these treatments so that together you can decide which is the best option for you. And well, friends, that's all for today's video. If you have questions, leave them in the comments because I will be answering them. I am Dr. Pau Zúñiga, and I'll see you in the next video. Goodbye.